one more session of a YouTube live. I hope everybody has joined in so we can start a live session immediately. Let us have some questions by the time. Yeah, welcome, Dr. Kocher. Good afternoon. So let us start a session. And in today's case, I'll discuss a very interesting case had come. Before I discuss a case, I hope there were few questions which were not answered. Last time. So if you can pose those questions, I will start answering. Welcome, Dr. Subhasha, Dr. Smith, Dr. Weber. So I had a very interesting case, interesting case of vertigo, and the vertigo was very, very of a long duration. That had been referred to me by one of the friend of mine. And apart from the whole case which I took the case, the most important symptom which I found was that the vertigo of the patient was because of lot of anger. The patient had lot of anger in himself, lot of anger. Every time he was angry only. And because of that, because of anger, whenever he got angry, he started getting vertigo. This was the crux of the case, the entry point what we took a case. And surprisingly, a simple remedy cured that case. I gave that remedy in 1M potency. Within a span of 3 months, the patient was 90% better. Oh yeah, welcome Dr. Borwala, Dr. Minthali, Dr. Homeo and Dr. Vishaka. So, the remedy which I gave to the patient, that is very, very important, very, very important. Can you guess the remedy? Anybody? See, whenever anger comes, we have few remedies which are very, very common in our practice, and we have tried those remedies. But in this case, the remedy was very, very interesting and very, very surprising for me also. But basically, Homeo, how are you, sir? I am fine, thank you. So, Dr. Pallavi, welcome. So, what basically remedy which I had thought in this type of condition? Can anybody tell me? We entered the case where the symptom was vertigo, basically a very angry personality, and vertigo after anger. This is how we entered the case, and the remedy I gave in 1M potency. Within 3 months, the patient is 90% better, much, much better. So, which remedy comes to your mind first? Belladonna, yes, it's a very angry remedy. Anything else? Now, yeah, Naxomega, yes, very nice, is also an angry remedy. Anything else that comes to your mind? Naxom, yeah, Dr. Vishal, welcome. Dr. Tamanna, welcome. So we have answers like Belladonna, we have answers like Naxomega, we have answers like Chamomilla, lots of angry remedies. But I prescribed the patient 1 dose of Calcarea carb. Calcarea carb 1M, and the patient, as I told you, is much, much better with only 1 dose of Calcarea carb. And that is what I wanted to teach you all, that the other side of metamedic. Every time we have proved that Calcarea carb is timid. Yeah, Dr. Vishal. Hepasulf is also angry remedy. The main intention of sharing this case was that every time we feel that Calcarea is timid, Calcarea is brooding, XYZ, but we fail to see the other side of Calcarea also, where Calcarea carb sometimes anger is so much, and after anger the vertigo starts. And that's why we prescribed the remedy Calcarea carb, which basically cured the case. You must remember one thing also, in Calcarea carb, there is, if I have time, there's one question, so I'll ask that question. Itching of skin in CKD patient. In chronic kidney disease, remember one thing. When the creatine goes high, when the immunity goes low, the patient has lot of itching. He keeps on itching. I had tried in my practice remedies for itching. I had gave those patients remedies for itching in CKD, which I thought in my past practice, maybe 10 years back, that we can only relieve symptom, because I had never seen a cure of CKD. But still, I would suggest you that because of the low immunity, because of high creatine, the itching has increased. So do take the whole case before you prescribe on symptom in CKD patient. It will not work. It will only work temporarily. But the remedies which have got very, very good results in CKD only for itching, if you say, the first is Bovista, second is Apis mellifica, third is arsenic album, fourth remedy, will be surprised, it is Oleum animale, and the fifth remedy is Rustox. These 5 remedies have given me very good results in acute cases where I have not able to find out the similar on the first instance of case taking. So these remedies have given me fairly good results in case of itching with CAD. Yeah, so I was just telling you something about Calcarea carb. So Calcarea carb, don't always think that the remedy is only good for that timid type of constitution, and we fail to forget that calcarea carb has such a wide variety of what you call action, that you'll be surprised that if you open the mater medica, and if you see, calcarea carb is a remedy where there is lot of anguish. Remember this symptom, remember this symptom of calcarea carb, lot of anguish. इतना ज़्यादा anguish लगता है, and the anguish is most of the time present with palpitation. Yeah, good afternoon, Dr. Meera. So whenever the anguish is anguish with palpitation, do think about calcarea or arsenic. पेशेंट बोलेंगे इतना दुख होता है मेरे को, इतना तकलीफ होती है, आई एम सो पेनफुल विद द सिचुएशन, व्हाट ही टोल्ड एंड व्हाट आई टोल्ड एंड व्हाट हैपेंड, एंड दैट कॉजेज lot of anguish, and it is always with palpitation. So whenever you get cases where the patient is suffering from anxiety, anticipation, depression, anguish, just see how the body reacts. Some patient might get a lot of palpitation, some might get perspiration, some might get falling of hair, some might get itching of skin. See the reaction of the patient, and that will make you prescribe the remedies which are normally not thought of, because we have only a periodized mind of that remedy. I hope you are getting me what I hope you are understanding what I need to what I am telling you. Yeah, Dr. Idlisi, welcome. Reverence, Dr. Mukesh, welcome. Rangari. So whenever there is a lot of anguish with lot of palpitation, think about calcarea, think about arsenic. In fact, think about Viratram and pulsatile also. These remedies also have lot of palpitation because of anguish. But calcarea carb also has it, Dipanshu. So this is very important to see the other side of mater medica. Why only calcarea is given for timid personalities or personalities who are brooding, who are on the other side. There is some lot of other, a calcarea carb patients, if you see, will ask lot of questions. A calcarea carb patient asks lot of questions, and that is also I've seen in many cases. Patient keeps on asking questions, and then we normally try to give lachesis or those remedies which are very inquisitive, but forget calcarea carb. In fact, if you see in a mater medica, brata carb also asks lot of questions, but the question of brata carb, question of calcarea carb are something very different in treating in what you brata carb maybe asking some silly questions which are not relevant to the topic out of. That's brata, and calcarea carb is something else. Yeah, anguish after horrible things. Yes, Dr. Vishal, that's also calcarea carb. Very nice. So we have a question: chronic recurring boils for 10 years and IBS, taking homeopathy medicine for a year ago. Improvement, please suggest. Yes, Dr. Vishal. One thing is very important to understand whenever you're treating of case of IBS, irritable bowel syndrome. The name itself suggests, that is irritation. You have to find out where was the irritation and why did the irritation start. It is not a simple irritation, what you call, where the patient says just irritation. The irritation which has hit the patient so much that it has affected the bowel. It is called a brain-gut connection, the serotonin part we say. Ask that first. And patient is suffering from recurrent boils. Now, this is also very, very interesting question. Whenever we have skin symptoms or whenever we have boils coming from the body, we normally think about remedies like sulfur or calcareous sulf or silicia or hepar sulf. But in your case, do think about 3-4 remedies which are very, very important. IBS and recurrent boil for 10 years. That is very important. Think about lachesis, think about sorinum, think about staphylos aureus, think about chamomilla. In fact, it's a very interesting remedy. And think about causticum also. This remedy would help you in treating IBS with recurrent boils for 10 years. Dr. Harshal, welcome. Dr. Mohan Suryavanshi, welcome. Dr. Parnosh, welcome. You experienced it in gynecomastia. Yeah, gynecomastia, basically what happens is the development. It's a developmental age where the boys suffer from that gynecomastia, and it is a very embarrassing condition for a boy. He keeps telling me that it does not look good when I wear my inners, and when I go for the gym, people start laughing. I have seen in those cases, basically it is psychosis. There is an extra development, extra growth, something psychosis has happened. In that case, I normally have to prescribe only through history where the psychotic miasm is predominant. Of late, I have seen that previously when I was practicing, Simple application of remedies like phytolith and rutine potency also works very well. Do try that if you have not got the constitutional remedy right. Sir, how do you administer dose in globules or dilution or directly on the tongue? Yeah, normally administer in globules. IG level is 2500. Yeah, that's because of the allergic problem. That's why I told you the remedies, causticum, chamomilla, lachesis, sorinum, staphylococcus is also there. Petroleum is also there. These are the remedies which are very, very important. So, yeah, Dr. Mujahid, Dr. Deepa Lakshmi Saraf, welcome. So, I hope you got the answers for the questions, and immediately we go for one more questions. Yeah, the questions are answered. So, I give on tongue because of the lot of patients, and it's easy to take, that's why. Do try Dr. Vishaka local applications of Ruta or Phytolitha. That also works superbly in many of cases. When there's you can't get the psychotic history, you can't get the remedy right, and the patient becomes very impatient. It's very embarrassing for the patient. So do give that, because otherwise, other school of medicine, they start medicines like vitamin E tablets and XYZ tablets, and they don't get relief. So they become it becomes very, very embarrassing for the patients, and they try to do a lot of protein and then a lot of gym so that the breast does not appear as a female breast. That's the case. And of course, make sure that the patient has not taken allopathy medicine, because some allopathy medicines have side effects as gynecomastia also. So rule out that also in those cases. Yes, Dr. Vishal, I hope you got the answer. These are the 5-6 remedies you should think about in your case of recurrent boils for 10 years with IBS. Boils occur in most of chin, pustula-like blood. Which remedy can we... Okay. So, Dr. Harshal has a very specific question that boils on the chin. See, what happens whenever you are treating a case, and if there is a general liking, if a homeopathic doctor sees that the more the boils are on the forehead, on the cheeks, on the chin, on the nose, and we have a lot of beautiful remedies, for localized parts also. But let me tell you one thing, that whenever if you feel that the chin has lot of acne, I have found very, very useful with 3-4 remedies are very, very important. I have seen, especially in the chin, if the patient is suffering from acne rosacea, do think about one remedy, Viola tricolor. Very, very important. Acne rosacea. Simple acne, you can think about remedies like Viola tricolor is there, Hydrastis is there, of course, Sepia and Veratrum is also there. I hope Dr. Harshal you got the answer. Welcome, Dr. Trivedi. How to treat dyslipidemia where constitutional remedies cures everything but for high cholesterol levels? Yeah. See, dyslipidemia, where basically I've always told that in my experience, it is not it's not a law. What I have seen, that if the cholesterol starts accumulating in the blood, in the body, the solid contents increase and the cholesterol goes high. In most of the cases, I have seen that if a patient is suffering from grief, especially silent grief, bottled up grief, and the patient is not able to take out that grief, and then it basically piles up to that, and because of that, the patient suffers from dyslipidemia. So make sure that whenever you are treating a case of dyslipidemia, this has to be taken care of, because if you don't take care of that, you will not get a perfect cure. That is very important. Otherwise, for dyslipidemia, you can think remedies like you can have cratagus, you can have thiocinaminium, you can have lots of remedies. But I have found very, very important where the grief silent, especially silent grief is there, bottled up grief is there, everything is accumulated in the system, and then lipidemia starts. You have very good remedies. In fact, one of the cases I gave Arjuna simple in 6x trituration, repeated for about 10 days, and the cholesterol came down. So if you get Arjuna or cratagus in trituration potency, I have found very useful in these type of cases. In cases where the patient has a lot of breathlessness, and you find that the oxygen carrying capacity of the blood is decreased, and because of that there is cholesterol, Dr. Vishaka, think about the remedy vanadium metal. And in cases where increased cholesterol is because of old age, the arteriosclerosis, then think about iodine or thiosaminium. It works very well. This is what I have seen in my practice. Sir, one patient after having sexual thoughts suffers from intense pain and tickling in the pelvic region on right side, and it ascends to the top of the head only on the right side, gives Stepsic 1M, but no result. See, what happens, that means Just a minute. Okay, I'll just answer this question first. A very interesting question. I'll just answer this. See, whenever the patient is suffering from a problem where his basically body has been what you call stimulated because of a lot of sexual thoughts and all. So there is basically a sensation where the patient says that some patient comes and tell you, I feel as if the blood is boiling, the skin is hot, there is goosebumps, flesh and all. But in your case, you are very specific that the right side it ascends upwards. There are 3-4 remedies I should think about: Cantharis, Epismel, Pulsatilla, Lycopodium, Sarsaparilla. Very important remedies in your symptom. Just one question on Instagram. Oral cavity male cyst type, which remedy can we give? Oral cavity में cyst है. Okay. See, basically, if you just want some remedies for cyst, as I always tell you, there are in homeopathy you basically try to get what I call you some symptoms which are very defined. Just cyst in the oral cavity means there are so many remedies. You can write down. We have conium, we have calcarea floor, we have silicia, we have creosote, we have phosphorus, and we have sepia. What I have got results in my practice. So one patient having such, yeah. I hope Dr. Pandey, you got some inputs up from your question. Patient first 3-4 years suffering from boils, acne. Only after 3-4 years boils with acidity, burns, constipation, and again after 3 years allergic asthma, only with above problems. Yeah, so if the patient is suffering from recurrent boils, as I told you before, and acidity, so see, you can just remember one thing, that if you basically go for grand generalization, just take the symptom an unhealthy skin, and then if you go, there are a lot of remedies. But if you just see recurrent boils, then it is possible that you basically have what you call small group of remedies. So recurrent boils with acidity, we have very fantastic remedy. You can write down. You must think about petroleum. You must think about sorinum. You can think about phosphorus, and you must think about carbovage. Yes, I hope you got the answer. Of course, if you open the book, open the repertory, and see, there are if you only basically want boils, so there are remedies only for boils. As I told you, soranum is there, simple Merc-Sol is there, Hippar-Sulf is there. But with acidity, think about soranum, think about petroleum, think about fluoric acid, think about carbovage. These are very interesting and wonderful remedies in the condition. Now, just I would like to add one thing. Sometimes there are blood boils. Sometimes there are recurrent blood boils with acidity. Then think about phosphorus, muriatic acid, natramur, and iodine. So then you have to differentiate with boils with eruption, like we have anthraxinum, we have arsenic, we have tarantula. Boils which come in croup, then you have to think about sulfur, you have to think about syphilinum, you have to think about silicia. Then sometimes what happens, there is boils with a lot of itching. Then think about thuja. And the patient comes to you that I have boil, but it is not maturing, only boil ki boily, it is not coming out directly. Then you must think about remedy like silicia, sulfur, and Hippar-Sulf. So then, no, blood boil is not like lipoma. Lipoma is absolutely different, and we have discussed that also. So I just making a point of the answer is that sometimes you have to be very defined on what symptoms are you taking for prescription. If you open the chapter of boils, in a mathematics, there are so many symptoms, boils which are painless, boils which are very painful, boils with a very large, boils with a lot of itching. So there are a lot of symptoms and a lot of conditions, It is very important to define which type of boils, because otherwise you land up in the routine remedies for skin, like sulfur is there, Hippar-Sulf is there, calcarea sulf is there, mercury is there, and we always have that same prescription. But try to define the boil, and you will get a lot of remedies and a lot of good remedies and specific to that also. Girl 14 years old. In the past, some students said that they don't want to play with her because she is good student. This affected her in a lot, and even after 5 years, she can't get out of the mind. Yeah, this is such a grave problem of bullying, and you basically target a particular student or a girl or a boy, and that creates such a bad impression for life for the student, and we have lot of cases. Simple as that. It is very important that first of all you counsel those patients, and then go with the case, because counseling is very important in those cases. And see, these personalities, basically you have to understand, these are timid personalities. They can't come out with the emotions, so they cannot fight sometimes, they cannot speak sometimes. That's why people take advantage of that. So we have remedies like Bratacarb is there, Calcarecarb is there, Silicia is there, Plumbum is there, Pulsitla is there. Very, very timid in the Sora, and that's why people take advantage of them, and that carries a very grave impact on the life. Now, depending on what is the impact and what the body is trying to show, for example, the patient, a person who is a brilliant student now has become very dumb and cannot remember, so it has affected the mind. Or the patient suffers from eczema and itching, or the patient's asthma, or the patient has hair fall, or the patient has different problem because of that which is there in the mind. So try to find out what is the expression of that thought in the patient's life, and then you can prescribe it better. Sir, is Parkinson's curable? Is there any role of cannabis sativa in Parkinson's? Yeah, Dr. Pandey. As I always told you that I will only basically tell something which I have cured in my practice. I have few patients of Parkinson's. They are very much better. We have tapered down the medicines, but still they are taking allopathy medicines, and they are much better with the medicines. Now, regarding the part where you say that cannabis sativa is in Parkinson. Now, in allopathy medicine, there are cannabinoids oil is there, that you just give 2 drops of that oil, and it's a treatment for Parkinson's. It's a treatment for convulsions and all, but basically I have not used cannabis sativa for Parkinson, because in my what you call knowledge, what I've seen in my practice, Parkinson is because of dopamine degeneration. Means that it's a neurotransmitter where there is the feel good factor is not there in that patient, and the patient has never what you call got applauds in his life, because he has done so much, but nobody's applauded him. In those cases, I have seen a lot of trembling and a lot of Parkinson's. So my entry point in case of Parkinson's is through this, rather than give any remedy which is very specific, like cannabis is there, belladonna is there, conium is there, arsenic is there, but I basically enter through that concept rather than this concept. Of course, that's how I am treating cases and having good results, but still not cured case of Parkinson's. They are much better. I hope you got some answers. Yeah. So a few questions on the Instagram have been scrolled up, because there were a lot of questions on YouTube, so I could not see the Instagram questions. So if you have any questions, you could write down. Again, a case 42 years woman, she was operated right frontoparietal region tumor. Which remedy can be used to avoid recurrence? Yeah. So see, Dr. Herschel, it's a pure case where the constitution is trying to come out in the form of tumor. It's a purely psychosyphilitic case taking, and the constitutive treatment is very, very important. In acute, when I was attending few doctors, they used to give some remedies like calcarea floor, ruta, silicia, and you can try that. But constitutional remedy is a must to break the tendency of tumor. For non-healing wounds, pus culture shows 2 bacteria, Staphylococcus and E. coli. No, yeah. So there are remedies called as Staphylococcus and E. coli, but I have not used those remedies for these conditions. I'll go with the case taking and all. So that unhealthy skin, and then prescribe the remedy. Mohan, can homeo medicines cure anorectal fistula surgeries? No. Dr. Mohan Suryavanshi, yeah, anorectal fistula can be cured. I have few cases where I have cured anorectal fistula. Absolutely curable. Gallstone 5 mm, please medicine. Yeah, gallstone 5 mm, Dr. Magir. I had told few remedies for gallstones which are very, very common. I've used in my practice. Filtauri first, cholesterinum second, Berberis vulgaris third, belladonna fourth, and fifth is calcareca I've used. And of course, don't forget cardosumar also. What in Parkinson's, farmers with all poisoning other reason? Yeah. If it is because of poisoning, and it is because of degeneration of nerves, so you have that toxic effect in the body. So because of that toxic, there is a degeneration of dopamine also. So you have to take where the toxicity has hampered, and which toxin the patient is exposed for. That is also important. In India, we have seen a lot of cases of organophosphorus poisoning where the patient suffer. After the poisoning, the effect is there's a lot of trembling and Parkinson's like symptom. In those cases, we use remedies like Crotalus cascavella, Crotalus horridus, phosphorus, opium, Nux vomica. What's on the next sort with no not so specific symptom, physical or mental? How to proceed? Yeah, what's on the next? Sometimes the most difficult case, Dr. Mohan, is basically treating warts, especially on the neck. It is like skin tags, and very difficult to treat skin tags. But you could think remedies like thuja, silicia, sulfur, or calcarea fluor. But thuja, silicia, nitric acid, and have given me very good results. In LM potency. Feeling of bladder infection, but urine shows no inflammation. The answer lies in the question feeling. If it is structural, then it's a problem. If it shows some deformity or cystitis, or because of infection the size of the bladder has gone small, then the patient basically cannot urinate because the accumulation is less. In those cases, the remedies are different. But you are talking about some functional problem where the patient is suffering from recurrent infection. If the patient is suffering from recurrent infection, basically the problem is that the body's immunity has gone down. So it is very important to take the case to get the symptom, to get the constitution on the right track. Can I have arsenic 30 for cold, fever and body? Yeah, you can have arsenic 30 for cold, fever and body. Yes, with sneezing also. The case of patient suffering from pain from sexual thoughts started from lingering too much on lascivious thoughts. Okay. After that, he got pain in the right testes. He gets relief only after ejaculation. Yeah. So basically, we are talking about constitution. Dr. Pandey is of amorous disposition. Remedies would be like what I have told you. You can add few remedies with that. Of course, cantheria is very important in this case. Nux vomica is important. Phosphorus, causticum is there. Pulsatilla is there, and veratrimab also is there. These are very, very common remedies which I have found useful. How to treat vitiligo? Of course, Dr. Pallavi, for me also treating vitiligo is definitely very difficult. Though I have treated fully few cases of vitiligo, and if you see aphorism on one-sided diseases, I go exactly the same way what Hahnemann has written about one-sided disease, and that's how basically I treat cases of vitiligo. Yeah, I hope that's maybe very fast in answering because the questions were thrown very fast, so I had to answer fast. Next question. On Instagram, you could write the question again because it has already scrolled up few questions. And happy Diwali to all of you. Today is Panchami, so I hope you enjoyed your Diwali and a very prosperous New Year. Constant noise in 1 year, allopathy diagnosed osteosclerosis. Yeah, Dr. Trivedi. Now, noises in ear, whenever you have noises in ear, Meniere's leg disease, and it's very, very difficult to treat because any whatever remedy you give and it basically works for some time, then again it comes back. So in your case, you have basically written osteosclerosis. So in osteosclerosis, think about few remedies which I have got very good result in my practice. First is Moxol, second is Silicia, third is Calcarea silicata, fourth, a very important remedy, Asafoetida, and fifth, again, strontium car. These 5 remedies have given me very good results. Yes, Dr. Riaz Ahmed. Yeah, welcome. Some questions on YouTube might also have scrolled up, so you can always answer the same question because we are live on both Instagram and YouTube both. Do we have few more questions? Can infertility because of AMH deficiency be treated? Gynecologist says that a patient IVF. Yeah, I told you, I think this was a question last time also, an anti-Mullerian antibody. And in fact, I had just a case, the cases from Rajasthan, and the patient last week had called me that she has skipped the period. In her case, the hormone was low. So I'm waiting for a result, whether it is positive or negative. But she was the case and she's much better. It has gone up and it is improving. Though it requires a very detailed case taking. It's basically an art. So it is definitely curable. What happens to that case of Rajasthan, I'll get back to you in my next YouTube live. Dr. Maya Wagmare, welcome. 60 years male patient suffering from right knee pain, aggression, walking, rising, emulsion, warm, message, jacaranda, bryonia, symphytum, nosode, ruta, no relief, please suggest medicine. See, whenever you're treating case of right knee aggression, walking better by warm, in most of the cases, you'll have symptoms like this only, that patient starts walking, the pain is more, better by a warm. In this case, it is very, very important, to understand how is the pain. How is the pain and how is the patient reacting in pain. See, you have lot of patients where there is lot of pain, but the patient says that he is able to bear that pain. In some case, the patient is not able to bear that pain. So, just by giving symptom, I'll give the remedies also. But just by this symptom, don't prescribe, because better by warm you will get in most of the cases of arthritis or just pain in the body also. Better by massage, better by pressure. These all symptoms are very, very common. So, in this case, you can write down the remedies. What remedies I have found useful in most of the cases, I'll tell you. There are, of course, so many remedies. If you open the Repertory or Mater you'll have lots of remedies. But in your case, do think about China. You do think about pulsatilla, verbascum. Think about iris versicularis. Think about phytoleuca, floric acid, gelsemium, calcarea phos. In fact, I told you some acute remedies also. I told you something about guaiacum, Erenia diadana, nephyllum, salicylic acid, negudium. These are very, very sporadically used remedies, but at least for the breathing time till you get the constituted remedy, you can prescribe this remedy and get some good results. Dr. Rushabh Shah, welcome. So I think that's all for today, and we have just finished half an hour of marathon of question answer. Thank you so much for joining, and thank you for asking good questions so that I also learn from what you have asked me questions. So until next time, meet you on next Saturday for one more interesting session of YouTube Live. Until then, happy Diwali and thank you.